Hello everyone, and welcome to another edition of Eyecare Today. I'm your host, Dr. Thomas Kislan, and today we're coming to you from our Tannersville location, Stroudsburg Eye Specialists, located in beautiful Tannersville, Pennsylvania on Route 611. Remember, if there's any questions or any suggestions for shows, please give us a call. Our phone number here in Tannersville is 570-421-3342. And if you're watching out in our Hazleton area, Hazleton Eye Specialists, located on the Airport Beltway in Hazleton, 570-453-2020. Catch us on the web anytime. Our website, www.drkislan.com. And remember, you can download the SSP TV app. Got it right here on my phone, so we can watch our shows all the time. All of Eyecare Today's shows are on the app, so you can look at them. We have some great topics that we talk about: macular degeneration, glaucoma, children's vision. Anything you might want to hear about as far as eye care, you can find on the app, on SSP TV app. So today we have a couple very special guests with us today. And so first, Dr. Belanger, who's one of our staff doctors in our Tannersville location. She's born and raised in the Tannersville area, and we're lucky enough to have her come back and practice in the area. So welcome, Dr. Belanger. Thanks for coming. And our very special guest today is Stephanie. Stephanie has a great story that we're going to tell. And before we actually started the show, we were talking about how patients have certain conditions, go to hospitals, things aren't really moving along the way they should, and they end up at the eye doctor's office, and things can really take a different turn. So Stephanie has a great story to tell, and Stephanie, thanks so much for coming and sharing your story with the public out there. I'm going to give a little background of Stephanie's story, and then I'll let Stephanie jump in here. Stephanie, last year in around July, was starting to get some headaches, which increased in intensity all the way to November of last year, to the point where she went to the hospital 6 or 7 times. Is that right? You went to the hospital maybe 6 or 7 times. So kind of take it from there. Tell me about your headaches and kind of how you were feeling and kind of what happened.
Okay, well, I normally experience headaches. It wasn't that long. So when I first started getting them, I didn't see the difference. I didn't notice the difference. But then I started noticing that my headaches were longer and more aggressive and more painful. And I did what any normal person would do: go to the emergency room, seek some help from a doctor to see if there's something that could possibly be going on.
So were they making you nauseous? Were you unable to drive and work and things like that? Were they really affecting your life?
They were affecting me to the point that I wasn't really able to sleep. I wasn't eating that much, and I wasn't able to be family oriented. I laid down a lot, but I didn't rest. Okay. And then I kind of wanted to be sectioned off in a dark room and not really have a lot of noise. So any family activities or any gatherings or sports or anything that I normally did, I couldn't do anymore. And that was my first alarm that, hey, something's really going on.
So you went multiple times to the hospital, and what was the story every time you went?
They were just telling me that it was minor headaches and that it was normal. And they couldn't really explain why it was happening. Maybe it was stress. They tried to tell me that it was because of my PTSD, and because I was upset at that was causing residual headaches. But it was nothing that was alarming, according to them. It was nothing that I needed to get a second opinion on or really search and try to do some research on. A pill and I was fine, according to them. A regimen and I was fine.
So they would just give you medications every time you went and try to give you certain migraine or headache medications every time you went?
Yeah, they gave me the concoction, the Benadryl, the steroid, and they gave me this in combination with the magnesium, and they would say, okay, this is what we normally give a person who has a headache, and it should clear it up right away. And it did. Because I had that pumped directly into my veins. I was in the hospital for quite a while, and it relieved me while I was there. But when I left the hospital, I would come home and have the same exact issue as soon as the medicine wore off.
And everything we're hearing now about the opioid crisis, as you were going back to the hospital, did it get to a point where they were thinking you were drug searching?
Yeah, I think that's the main reason they thought I kept coming back, because they would say, well, we can give you the same thing that we did last time, but it's just a minor headache. It's not really anything that you have to worry about or anything that you have to do. So I think they thought I was coming in searching for a different pill, something different to have, which might be happening today, but it wasn't my story.
Right. So that had to be frustrating. That had to be extremely frustrating.
It was upsetting. It was very upsetting because I was being judged based on how I look, how I came in, and they assumed that that's all I wanted. I just wanted a quick fix and then go home. And the funny thing is, when I went there, I told them, don't give me any opiates. Don't give me any. I don't want anything that's strong. I didn't even want an ibuprofen.
Right.
I wanted something that was going to help me, not something that was going to mask the pain for a moment.
You just wanted your headache fixed.
That's it.
That's all you wanted.
That's all I wanted.
And you had scans, right? They did some MRIs, right? They did the usual MRIs and blood work. Is that correct?
Yeah, they did a couple of CAT scans actually. Then they said they did an MRI, which turned out to be, I think, an MRV or something different than an MRI. Okay. But they kept repeating these steps over and over and over again, and they were giving me the same answer. Like, it's the same thing. There's nothing on the scans. And then that's when they told me, maybe after the third or fourth time I've had it, that they saw a dark spot. So it started to make me think, wait a minute, if you're starting to see something different and you've been running these tests over and over and over again, how long have you seen something different and never expressed that to me?
So, that started July of 18 to November of 18, where it really got intense. And then it was, just remind me, you're how old?
I'm 34.
34. So 34-year-olds should not have these intense headaches. That's really not a normal process that we see. So that brings us to, I believe it was January of 2019, where you decided what? You kind of just thought, well, it really had nothing to do with your headaches, right? You kind of decided you need to get your eyes checked.
Yeah, I decided I just needed to get my eyes checked. But during that time, I was aggressively searching on trying to get an answer because I believed myself. Even though no one else believed me, I believed myself. I believed that there was something going on. I just didn't know what that something was.
And that's an important point because, patients know their bodies. They know their eyes, they know their bodies. So if there's something wrong, it's important to search for those answers. I don't want to leave everyone hanging on that, but we do need to take a quick break here. When we come back, we're going to hear more of Stephanie's story. We're going to talk to Dr. Belanger, who actually saw Stephanie when she came in just to have her eyes checked and see what happened as far as her headaches go. So we'll see you after the break. You're watching Eyecare Today. We'll be right back. Welcome back, everyone. Again, you're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, and we're coming to you from our Tannersville location. Stroudsburg Eye Specialists located on Route 611 in Tannersville, 421-3342. And remember our Hazleton location, Hazleton Eye Specialists on the Airport Beltway in Hazleton, 570-453-2020. www.drkislan.com is our website, and remember, download the SSP TV app so you can watch all our shows. Don't watch any other shows on there. You just want to watch our show, Eyecare Today, on the app. So again, we're joined today by two special guests, Dr. Belanger, who's one of our staff doctors in our Tannersville location, and Stephanie, who was very kind to come and join us today, who's telling her story about headaches. And in the first segment, we were talking about her story, how probably 6, 7, 8 months she suffered with headaches that were increasing in intensity. She was under the care of a neurologist who kept increasing her headache medication, was at the emergency room a couple times, was hospitalized 6 or 7 times for the headaches. And then that's kind of where we left off, Stephanie, and you decided in January to make an appointment to get your eyes checked, right? Yes. And so you really just needed like a change in your glasses, wanted to change your glasses. So you called our office and made an appointment, and you mentioned you were going to cancel it, right?
Yeah.
Because you thought, I got other stuff going on. And,
right.
Right? But you came in, and that's when you saw Dr. Belanger. Dr. Belanger, why don't you kind of take it from there and tell us kind of what was going on when you saw Stephanie?
I assumed it was a routine eye exam for a young woman, and she had just wanted to change her glasses. And I remember walking in the room, we go through our normal stuff, and I had mentioned to her, I said, any, headaches, flashes, floaters, some questions I normally ask. And she had kind of mentioned the headaches, but didn't really, highlight on them. I think she didn't, I don't think she thought she would find any answers with us as far as her headaches go.
Right, she's coming to get her glasses changed.
Right.
Why would you mention headaches to the eye doctor?
Right, exactly. So we had done, the prescription check, and we were looking at the ocular health of the eyes, and I was a little alarmed when she had mentioned then the headaches to me, and then she also had mentioned some like color halos, I think.
Yes.
And that was something she was experiencing, and we kind of talked about the headaches and how they had been increasing in intensity since November. And then I, put things together with the visual kind of color halos, and then we talked about, I think, ringing in your ears as well. Yeah. So we obviously did a dilated fundus exam, and on that I was alarmed when I saw her optic nerve. So her optic nerve appeared to be a little swollen, maybe a little discolored, not as red as it's supposed to look.
So just let me jump in there. So just for the folks at home know, the optic nerve is that thing in the back of the eye that sends the message from our eye to our brain and back, and kind of helps process the information. So if there's anything wrong with that optic nerve, as Dr. Bellinger's saying, things aren't going to be right. Okay.
Right.
Correct. So.
Yeah, so I had said to Stephanie, your optic nerve is looking a little bit suspicious to me, that maybe your headaches are not just migraines. And she had mentioned to me that she's had some pretty clean MRIs, clean CAT scans, so we kind of rule out any type of large mass or any type of tumor that could be in the brain. Those are things that we initially think about. So I had, the first thing that came to my mind was something called pseudotumor cerebri, which is when the intracranial pressure, so the pressure inside the brain, is actually elevated because there's too much fluid in the brain. So that was one thing that alarmed me. So a couple of tests we ran that day. We actually are able to scan the tissue around the nerve with an optic nerve OCT. And that information showed that she probably had some swelling that got so severe in the back of her eye that caused some tissue to be damaged. And the swelling is actually, in pseudotumor cerebri, is actually fluid that pushes through. The fluid in the brain is too high that it kind of pushes through to the extensions of the eye behind the optic nerve. So that's something we had talked about for her, and we did some tests, and everything kind of was indicative that this is probably something that was going on, and she was being treated for migraines, but these migraine medications were not helping this condition at all.
And also we did something, I believe, called a visual field test that showed she was missing part of her field of vision, which kind of goes along with some swollen optic nerves. Now, at that point, you had contacted the neurologist whose care she was under, correct?
Correct, yeah. So Stephanie and I had talked. We had her come back the following week for some additional tests on ERG and a VEP, which can also measure the function of the retina cells as well as the tract from the optic nerve to the back of the brain where our visual cortex is. And I called her neurologist, called her nurse practitioner, which I think she also was under the care of, and I said, hey, listen, things are very suspicious of pseudotumor cerebri, and at that point she's had pretty clean MRIs, clean CAT scans, so the next step would be to run a spinal tap. And
so explain what a spinal tap is for the folks out there.
So a spinal tap is basically a procedure where we can tap the spine, and it actually extracts some cerebral spinal fluid. So this fluid that travels the course of our spine as well as our brain. Fluid is all, within that tract. And some people have it done for some infection type things. We can test the fluid to see if there's any type of meningitis and things like that going on. But we also can test the pressure at which that fluid can come out, which would test the pressure in the brain. So that was a very important procedure to have done to see if she had elevated fluid in her brain. And that's what we did.
So it's kind of like a garden hose that has a lot of pressure inside that's abnormal. You poke a little hole in it, and if the water comes squirting out really fast, you know the pressure's high, but if it's not, then it's normal. And like you said, there's that normal pressure in there, but if that pressure's too high, that's going to be squeezing on the optic nerve and can cause not only us to see the swelling, but also the patient to be able to not see well or get headaches because of all that pressure in there. Now, what did the neurologist say about doing a spinal tap?
So when we had talked to the first neurologist Stephanie was under the care of, he didn't think it was warranted. He thought that she was under good treatment with her current treatment. He didn't think it would add really any help to what her current course of treatment was. So I think Stephanie and I had talked about that, and we both kind of said we need to investigate that a little bit further.
So we're going to take another quick break there, and when we come back, we're going to hear what the next part of Stephanie's story was as we try to figure out what's causing Stephanie's headache. So catch us on the next side of the break. Again, you're watching Eyecare Today. We'll be right back. Welcome back, everyone. Again, you're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, and we're coming to you from our Tannersville location. 421-3342, Stroudsburg Eye Specialists in Tannersville, and our Hazleton location, Hazleton Eye Specialists on the Airport Beltway, 453-2020. And remember our website, www.drkislan.com. And just to review, we're talking about headaches today, and we're joined by Dr. Belanger, one of our doctors in our Tannersville location, and Stephanie, who came into our office basically just for a routine exam. She told her story in the first two segments about how she was suffering for headaches, but decided she needed her eyes checked to get some new glasses, and came under the care of Dr. Belanger. And we left off where Dr. Belanger had recommended that we get what's called a spinal tap, where we check the pressure inside the spine to see if there's any increased pressure that could be pressing on the brain and specifically the optic nerves. And the neurologist whose care Stephanie was under at the time said that really was not indicated. So you guys discussed that and decided what?
Yeah, so Stephanie and I had sat down and discussed, we put all of our tests together and we sat down and said, you know, I think at this point it's time for a second opinion from a different neurologist. And we found a different neurologist, and it was Dr. Gupta that we had sent her to. And I think, Stephanie, he was, as soon as I think he got you in maybe the next day, within the next week after we had spoke. And he was all for doing the spinal tap. I think that was something he was, thought was very, very important.
So were you a little apprehensive about having that done, or were you just kind of like, whatever I need to do to fix this?
Yeah, I think at that point I was like, all right, if this is what I need to do, then this is what I needed to do. I just wanted someone to explain to me why it was necessary, and that was the one answer I really couldn't get.
Right. So you went to the hospital, right? He took you in the hospital and did the spinal tap, and what did it show?
It did show that I had a slight elevated pressure, which he assumed was there. He completely agreed with Dr. Belanger, and he said it. You should have had this a long time ago. And he said, I can guarantee you that there's going to be something there. If it isn't there, then okay, we did a test for no reason, but I don't think that's what we're doing.
Right. So everyone was on the same page. Dr. Belanger, Dr. Gupta, we had all the information, all the tests we put you through, it all pointed to this one thing, that just by coming in to get your eyes checked for glasses, we kind of figured out that after 7 months, you weren't getting any answers for. So Dr. Belanger, you found out that her opening pressure was pretty high, and what's the course of treatment now?
Yeah, so I think I had tried to keep in touch with Stephanie. I know she had done the spinal tap, and I still was eager to hear the answers. I wanted to really make sure that we got her right on the right track. And so the course of treatment now for the elevated spinal pressure or brain pressure would be to get that pressure down. So it's usually a medication called Diamox, which helps reduce the fluid around the brain. And that in itself can have some side effects, but Stephanie was on a ton of medications for migraines that were really trying to mask the symptoms instead of help the underlying problem. So that was really important. I was super thrilled when we found out what was wrong. Not that I wanted anything to be wrong, but this was giving her some answers.
Now, Diamox, is that a pill or is it an eye drop?
So Diamox is a pill that you would take by mouth, and there's different, obviously, doses of it and strengths of it, but it can have some side effects in itself, like I said, but it's actually, so this is a systemic condition that affects the eyes, so oftentimes in that case, that's what we have to do, is take pill medication by mouth.
So you were given the Diamox, and what happened after you started taking it?
Well, I did notice the side effects, but I also noticed that I was able to maintain my day. I work, I need to operate during the day. Being on a ton of medicine doesn't allow me to fully function, and I need to function while I'm at work. The Diamox allowed me to function and not have that 4 or 5 hour headache that I would normally have, and it was sometimes so severe that I was leaning on a migraine. And when you're at work and you're in the public, that's just something you can't experience.
Right. So we're 5 months past probably now where you first saw Dr. Belanger. How you doing?
A ton better. I say to myself that if it wasn't for Dr. Belanger and Dr. Gupta, who I feel saved my life because they believed me. And that's something that we need. You need to keep fighting until you find a doctor that can believe you and that will treat you the way you're supposed to be treated. So now I feel like I'm starting to kind of get back into society. I'm able to go out a little bit more. I'm having more family events. I'm able to socialize and be normal, which I didn't have before.
So Dr. Belanger, what would be your message to patients that just come in for an eye exam, but they have other things going on? How important is that history, and how important is it for patients to tell their story?
Yeah, it's really, it's something that we deal with a lot, I think, in eye care, because people kind of assume that we're here for glasses, contacts, but there are so many things in the body systemically that we can see and present in the eye, and we can investigate things. I mean, we have other outside physicians that are sending patients to us to give them more information, and there is so many things. I always tell people, you know, the eye is one of the only places that we can see a nerve, see active blood vessels, see a pulse without cutting you open. So, and anything that can be occurring in the back of the eye can be occurring all over our body. So it's one of those things that don't just come in because you need glasses, contacts. If you have any type of problem, tell us, let us know. We can investigate things further, but it all is very much tied together. And
we've talked on these shows before about patients who came in for a regular exam and there's a little freckle on the back of the eye. It turns out to be melanoma. You know, there's all those stories, diabetes, things like that. And it's got to be rewarding for you to, you know, basically see a patient like Stephanie that comes in frustrated, can't, you know, live her life, and by simply coordinating with the proper physicians in the area, who we have great physicians in this area, within probably a matter of 2 weeks, get her back on the path of living her life.
Yeah, absolutely. I took Stephanie's case to heart because, you know, she's a young woman, I'm a young woman. We really have to do everything we can to, you know, help each other. I'm very much about helping all of my patients in any way to get back to, you know, normal living. And I think that was something I took you know, personally into heart, was that she couldn't function with her family and she couldn't function with her friends, and now she can, and that's amazing. Yeah.
And I don't just say this because you're here, but I see all the time that you have charts on your desk of certain patients, and you'll be calling this one, and you're calling how you doing, and you're following up with this. And I think that's kind of what separates you apart from maybe some of the other eye doctors in the area, about how you really do take this personally. And you know, I think if you didn't, probably Stephanie wouldn't be in the position she is now, able to comfortably live and be sort of headache free, and at least getting on the right path. So Stephanie, I told you this was going to go fast, and it did. We're just about at the end of the show, and I just want to kind of reiterate what Dr. Belanger said to everyone. You know, if you have any issues that just don't seem to be, going the way they should, come in, get your eyes checked. The eyes are the window of the soul. We can see a lot by just checking the eyes. And Stephanie, again, thank you. Thank you very much for coming in and telling your story. It's a heartwarming story. We're very glad that you're doing well. And we know Dr. Belanger is going to continue to take great care of you. Dr. Belanger, thanks for coming in.
Thank you.
Remember, everyone, you're watching Eyecare Today, and we'll see you next time.